Citizen TV. I'll start from this end with Stephen Latour. Thank you very much for being with us, Stephen.
Thank you. Thank you, Lillian.
Also with us is Elphas Lagat. Thanks for being with us, Elphas.
Thank you, Lillian.
We're also joined by Ben Kirui on this end and the very lovely Chemutai Goin. Thanks for being with us, guys. I'll start with the lady. Chemutai, you've covered transformational news events. How different has it been covering the COVID-19 pandemic?
Well, Lillian, first, when the pandemic struck, there was very little information about it. And as journalists, members of the public rely on you to possibly just give them that information as accurate as you can be. There was a lot of misinformation about it. We even saw some people indulging in alcohol, thinking that, when you consume it, of course, you kill the virus. There are those who took sanitizer because it had this particular percentage. So as a journalist, your job was to weed through that information that is coming out and make it palatable to the members of the public. You break it down. So that was the main thing that when it came out, and that's why when you had the initial briefs, remember the COVID-19 briefings by Mutahi Kagwe, there was a point where Kenyans were focused on it. Every day they would wait. Then it got to a point where there was a little bit of fatigue, and that's when now the critical role of now trying to bring back members of the public into remembering that this pandemic is still there. It's killing people. It's of course making others less functional people of society because you're sick for about 14+ days. So there's a lot of work for us just to help the members of the public understand it.
And for you, Latour, very early days of the pandemic, you were actually on JKL Live, and you personally had a personal story of your own.
First of all, Lillian, this is the first time ever I'm covering a pandemic that is invisible, an enemy that has consumed now over 1,000 lives in the country. And for us, the biggest challenge was running towards the killer, because we are at the front line, just like the doctors. You have to be there so that we inform our viewers of what is happening. But at the same time, you know very well that wherever you are going, whatever you are doing, you might be, circulating around the virus. For me, when we reported every single day about today there's this number, we started with 1. And then we went to 2. It started going like that. By the time we got to 10, it began scaring us. By the time we get to 16, I think that is where schools were now shut. It began scaring us, even on the frontline reporting. Every time we go to the Ministry of Health for their daily updates, we get the new numbers. It became a crisis for us as the reporters on the ground when numbers hit 50 and above. When we started reporting 50 new cases on a single day, it became a crisis, according to us who are on the front line. But the biggest challenge for me was when you go to hospital or to see how the frontline workers are handling the COVID patients, how we are reporting that this patient is on ICU, this has been infected. The biggest shock for me was going to Nairobi Hospital to test and being told that, Latour, you're positive. I was called, I was on my balcony, and a strange call calls you, and they asked me, are you in a safe place? Are you in a calm place? Where are you? How are you feeling now? I had a conversation of about 15 minutes, only to be told after the 15th minute of my conversation with the doctor that called me that, we are asking you all this because you're COVID positive. I kept quiet for almost two minutes, holding the phone on my ear. Simu karibu ikuwe moto, nashika hivi. What do I say? Is this true? Am I dreaming? What is this? I'm looking around myself. Where am I? I'm home. What is this? Yeah. Is this really call, that the call coming in is that it is indeed that Latour, you're positive? Okay, calm myself down, and when I returned the phone to my ear, I said, are you there? Are you still there? I say, yes, I'm there. I was composing myself. What I did, I from that time I was called, I started going, now knowing I'm headed to my quarantine area.
Elphas, for you, very recently in Mbagathi Hospital, interacting with COVID-19 patients.
You know, Lillian, just as Leto said, we've never covered an issue as big as this. You know, reporting on the pandemic is of such a huge scale. And as you asked, recently we went to Mbagathi with Kirui and Kip. So, you know, initially we were ready. We told ourselves, I mean, with the PPEs, the doctors have been doing this. Then on the morning, I think it was on 17th of November, when we got here, I realized that I wasn't ready. You know, you feel, am I really ready to go into the COVID ward? And you know, you realize that most of the people, and this is the second wave of the pandemic, and you hear from the doctors that it's more severe. You're getting patients who are between moderate and very severe. You know, they're manifesting all those symptoms. So getting in there and actually seeing patients really struggling to breathe, you realize how real this can get. Realizing that there was even one patient who said, Nimbaya Kapsa, she's never experienced anything like that before. She didn't know that she was diabetic until that point that she contracted the virus. So there was that mix of, you also fear getting there because you feel something could go wrong and possibly you get infected yourself. And incidentally, as per the safety protocols issued by the health department, the nurse, and even the HR office, was that we need to quarantine for a couple of days first before we do the testing. Then ironically, on that same day, I had a bit of flu. So, you know, I'm telling myself, is it the disease now starting to manifest? So there was a bit of fear, but of course, through a debrief and talking with our fellow colleagues that we covered, we were able to navigate that process. Yeah.
For you, Kirui, as well, I mean, the threats that you were facing right there at Mbagathi as you went with your colleagues to cover this story, but your desire to tell this story, share that with us.
Yeah, naam, ni ukweli Lilian. So, wakati ambapo tulichukua uamuzi wa kuingia ndani ya Mbagathi, ilibidi kwanza tujitayarishe kwa sababu tulikuwa tumeelezwa tutaenda quarantine ukipenda, ikabidi sasa wale.
He was the most scared because he's the youngest in the music.
Yes, he's the youngest in this room, by the way. Yeah, so that was brave of you.
Sasa hiyo kujiandaa kuambia sasa wale ambao mnaishi na wao, itabidi, unajua sisi bado mabachelor, mnaishi kwa one bedroom hivi ama ni bed sitter. Sasa unashindwa utaji quarantine wapi? Si kama Leto sasa ako na bungalow atasema aji quarantine huko juu. Lakini kwangu ilibidi kwanza nilichukua uamuzi, nikaambia wale ambao nakaa na wao itabidi sasa nikirudi hapa jioni itakuwa ni mimi peke yangu. So watu wakaenda, sitasema ni kina nani. So kile ilitushtua kabisa kuingia pale, ndio nikajua kumbe hatukuwa tayari vile, kwa sababu umeingia umeambiwa hapo kwote ni COVID patients wako kule. Kuingia flow ya kwanza ndio nikaona sasa, nikakuja face to face na wale wagonjwa. Then sasa nikashindwa, sijui tuendelee ama turudi nyumbani.
And Chemutai, you spoke about the fatigue of the listener and the viewer in listening to this COVID reporting, and there was a time all that was in the news was COVID. So my question to you is, what about the reporter? If the viewer is feeling this fatigue, then surely this is also psychologically affecting the journalist on the ground. Was it exhausting for you at some point, and how did you cope with that? How are you coping?
Of course, Lillian, at some point you've done it all over. You've done it over and over again. You wake up in the morning, you know, a COVID-19 daily brief. What will be new? But I think the thing that maybe got the fatigue away was when now we started having now bigger numbers. So every day is a day where you're expecting, are we expecting good news? Are we expecting bad news? Then the numbers started rising. We had 0 deaths, then we started having 1 death, then all up to 26. When there was 26, it was a big thing, and I think that's when members of the public also just came back. And also, if as an individual you had fatigue, you wake up and realize maybe you still need to do a little bit more to teach the public and maybe just educate the public about how to protect themselves. But maybe one other thing, Lillian, that possibly changed for us was You know, before, well, it is routine that when you leave work, you go shower. But then for us that even have people, you have children, you have people at home, when we would get to the door, it's like a presidential thing. The door is open. You make a call from when you're headed home. The door is open. You literally just find a way of not touching anything. We're sanitizing every surface, you know. Take a shower, then now you interact with your family. And for us who have little children, you know, they like running towards you. So you have to lock them up in a room so that you get in, go change, then come back. So a lot for us changed. And I think we learned a lot more. For instance, I'm a political reporter, Leto, you're a political reporter, you're also a political reporter. When this came about, you have to learn science terminologies. You have to learn one or two things so that you also don't miseducate members of the public. So it was I really like, I think it was interesting because then we got to interact with leaders in sectors that maybe usually we don't interact. We have now doctors, you have a conversation, you understand symptoms, you begin to even feel yourself. We are mini doctors. There's a joke where people say it is this year that we've learned that our temperature is 36.4. These days when anyone has a thermogun, you're waiting to see what is up. So a lot has changed.
At the very first stages, it was very difficult to shift from political reporting to health reporting. But when we were now thrown into the deep end of the pandemic reporting, we had to cope. Like Chemutai has said, we had to go out of our way to start learning, at least do little, an extra research on the topic of the, the viruses, the terminologies that in the medical field. It was very hard for us to change and put on the health reporting hat. But along the way we did, because it came to us as breaking news, and with breaking news you can be thrown anywhere, whether it's a fire, a collapsed building, whether you're a political reporter, you have to do the very basic reporting. That is what we did from the beginning. Basic reporting for the pandemic until a certain time we could differentiate between coronavirus and the coronavirus and COVID-19. We didn't know why it was called COVID-19 until we were told that it is COVID, but it was discovered in the year 2019. That is when now we started just copying. For me now, we used to ensure we do so much also international news, watching international news, just to get what other quick benchmarking towards them. But also coming back to the issue of COVID and us being the front line. The worst experience was on quarantine for myself. I mean, it came to me when people were dying of COVID-19 at night.
But you were still reporting right from that room. I mean, you were still filing stories and sending them.
Yes, at least when I knew now I've stabilized the virus in me, I now started interacting with the office. I told them now we can be doing something so that, because that idle mind is the one that can also, haunt you or really traumatize you. Being in a quarantine, closed in one room alone for all those days, it's something else. So for me, it came at a time people were dying at night. COVID patients were dying at night. So I used to fear sleeping. So I make sure I sleep at 3 a.m. and wake up at 4, so that I just don't sleep at 10 and don't wake up.
So much has changed this year. Our colleagues have lost their jobs. Salaries have been slashed. It's been a tough year for the newsroom, for all of us. So in terms of journalism, for you having been in the front line, how has this year shaped you?
From financial downgrading to, just everything literally stagnating. But we found our way out. I mean, the very fact that we are still, pushing up with work is what has kept us going. But we know there are more sectors that has been worse hit. But being that May, we're still trying to see how we can maneuver around these contours of the pandemic and make sure we emerge victorious, because definitely the pandemic is still here with us.
Well said. Lagat.
Well, Lillian, as Leto has mentioned, we probably know someone who's lost a job, someone perhaps who's lost a family member because of the pandemic. And of course, that has really, informed how as society we need to realize that when something of this magnitude happens, there needs to be stopgap measures in terms of, you've seen how government has introduced, terms of, reducing taxes and whatnot. And of course, there are people who've found an opportunity to also, sell out masks and whatnot and try to survive the pandemic. And I think that tells us also as journalists that, doing 9 months of reporting, being able to think on your feet, that has also informed and enabled us to be at a better place in terms of telling these stories and holding government to accountable. We have a health crisis now. We have doctors who are out there, they're saying there are no PPEs, KEMSA and the desktop that is lying there. So I think as journalists, we still have that role of holding government accountable and telling these stories as it were.
Kuna silver lining. Every other time hakuna mabaya alafu ukose kwamba hakuna mazuri. I mean, the silver lining of it ni kwamba hata wakati tumekata mshahara, mimi nimekuja kujua kwamba kumbe naweza survive na mshahara kidogo, na pia huenda sasa ikirudishwa utakuwa una save hiyo pesa.
The rest of us don't agree. I see Chemutai looking at you. But then again, like you said, you're a bachelor. Different people, different opinions.
In January. Yeah. Even in this situation, you've been able to do meetings via Zoom, and people have been able to work from home, and things have actually been going on. So I think it's also given us a chance to relook at things that can be done to possibly improve, maybe it's the work environment, if it's even just how you carry out your duties. And then basically it has also taught us basic hygiene practices. Remember when the cases were rising in terms of the males had more cases as compared to the females, and they said part of science where the information was still not clear, but they said it could be because of the hygiene issue. Many would not have washed hands, but then now we realize more people are more careful. So I think going forward, after this, people will be more cautious about their health. With the reporting that we've done and telling people if you have an underlying condition, be safe, adhere to the guidelines. Now people know that you have to take care of yourself. People that you now are more cautious about what you consume in terms of even taking care of your body, being more physical, you see. So I think it's been a life lesson for everyone that there's something that you can do to change and make things better for yourself.
Right. And despite the challenges, they continue to be the biggest names in the country news-wise. These are the big names that you see telling the stories in this country and beyond on Citizen TV. And we thank you and we celebrate you. We're taking a break. We're back with more in just a bit.